Now we really try to look at what is a bamboo spine. Bamboo spine. So let me just gist you guys what's a bamboo spine. You guys have seen a bamboo stick, right? So bamboo stick seems to be like continuous. It seems to have partitions, but not clear partition like a normal spinal tract we have it. You understand? The partitions are very, very small. So when we say you are having a bamboo spine, it simply means these clear partitions between two vertebrae on the spinal, on the spine, is actually being reduced to form some very, very little demarcations. So it's just a classic radiological sign. It's most commonly associated with ankylosing spondylitis. Of course, you can't see it on the physical because I can't start dissecting the spine. I want to see this. No, I will image it. So mostly it's imaging that makes you to see it. So on imaging, you not see clear demarcation between two vertebrae, but you see some demarcation looking very little. Shows you that there's bamboo spine. So it's associated with ankylosing spondylitis mainly. Okay, which is a chronic inflammatory condition of the axial skeleton. So it's a descriptive term for spine appearance on the X-ray when the vertebrae becomes fused and they resemble the segment of a bamboo stick. So it simply indicates that there's chronic inflammation, okay, and it has led to ossification of spinal ligaments, the joint, and the intervertebral disc. So of course your spine is no longer flexible because the compartments are no longer clearly demarcated, so it's no longer flexible. So it shows you that the person has definitely been suffering from a rigid spine. So pathophysiology, so sacroiliitis, inflammation of the sacroiliac joint is the early hallmark of it, followed by what? Syndesmophytes. So you have tiny bony outgrowths from the vertebrae, then later on they are fusing. Is a tiny outgrowth. If they grow over a particular demarcation, they fuse. Do you understand? So giving it a bamboo-like appearance. The ligaments, so they are no longer flexible. They are actually having some calcifications in it, so they are ossifying. So radiological features, you see continuous ossification of vertebral bodies, loss of normal spine curvature, then railroad track or bamboo appearance. So clinical features is, well, the person will also be having chronic back pain to back it up, stiffness to back it up, reduced spine mobility, and some extra articular features like uveitis, aortic regurgitation, restrictive lung diseases, and the rest of it. You manage it by NSAIDs, also biologics and physical therapies. All of this could actually help.